India is celebrating the 150th birth anniversary of the father of the nation, Mahatma Gandhi. In that year, the Indian Council of Medical Research has brought out a very special volume, Gandhi and Health. I have with me Dr. Balaram Bhargav, a cardiologist by training and the Director General of the Indian Council of Medical Research. And this interview comes from inside the temple complex of Dalai Lama in Dharamshala, a very special place where the volume was released by the Dalai Lama himself. Dr. Balram, just show us the book and what does it mean?
Yes, this is the book, and we are so grateful to His Holiness the Dalai Lama for releasing this book, which is a compilation of the stories about Gandhi and health woven together around the 108 years history of the Indian Council of Medical Research, setting up its 26 institutes for different diseases like malaria, filaria, leprosy, tuberculosis, etc. And this volume has also been signed by His Holiness as we speak today.
Right here you can see the
Signatures. And we've had 3 guest editors for this special edition of the Indian Journal of Medical Research, which is the highest impact factor journal, any Indian journal in the world in any field from India. So the highest impact factor is of this journal, and this is being published continuously for the last 108 years, this journal. So this is a supplement edition celebrating 150 years of Gandhi and health. And the important point that I want to emphasize was that Gandhi had a huge perspective on health. He himself worked for the ambulance corps during the Boer War and the First World War. He helped in the Bengal famine. He helped in the plague, and his vision on health was basically mostly on the communicable diseases, but he also emphasized on healthy lifestyle, which is going to be very, very relevant when we are facing an epidemic of non-communicable diseases in India.
You were telling me that Mahatma Gandhi himself, before he went on to become a lawyer, wanted to become something else. Tell me a little bit about that.
Yeah, that's a very interesting thing, and in fact that he has written in his own autobiography, that I wanted to be a doctor, but I was a staunch follower of Jainism, and my mother was a Vaishnav, and therefore I abhor the idea of vivisection and dissection, and therefore his second choice was to become a lawyer, and he became a lawyer.
So how relevant is Gandhi and his philosophy in this 21st century?
I think it still is very, very relevant in this 21st century, particularly all the points that he had talked about in his book on Key to Health in the early 40s are still relevant, where he talked about clean water, he talked about cleanliness, he talked about village first, he talked about society together, exercise. He himself used to walk about 18 kilometers a day. And an interesting anecdote, little point I want to emphasize is that he walked 18 kilometers every day, and if you calculate the total amount, he would have encircled the earth twice.
Fantastic. Also in this book, you have unknown medical records for the first time being released of Mahatma Gandhi. Tell me a little bit about that.
Yes, this is an interesting, we partnered with the National Gandhi Museum at Delhi, and we were able to procure, and they, after approval from the committee, shared the health file of Gandhi for the first time. And we went through it, and we found his ECG, his weight, his height, his blood reports, his illnesses, his various doctors, and we have compiled that as the first chapter, which is talking about, you'd be surprised to know he weighed only 46 kilos. The man who gave us independence was just 46 kilos.
Amazing weight he carried in his mind for a man of his stature.
Absolutely. And when you talked about whether his points are relevant in this 21st century, he emphasized on mental health, which we are again facing an epidemic of mental health, depression, psychiatric illnesses, with all the more gadgetry that is coming around, and people are not spending time with each other. And he talked about that mental health in way back 100 years back. So, I think it's still relevant and it's going to be relevant.
So, so what further? What can the nation learn from this very interesting volume which you have brought about? What can the nation learn in times to come as to how Gandhi and his way of thinking, his philosophy should be relevant for India
I think that's
or the world?
absolutely. My first dispatch of these books will be for the schools in India. So all the school children, all libraries should have it. And more interestingly, and I just emphasize on one little page, we have got a small little page which is got the timeless voice messages, audio clips of Mahatma Gandhi on health, hygiene and cleanliness, on leprosy and health condition, on leprosy, stigma and untouchability, on cleanliness, on service towards sanitation, on work towards sanitation, and these are all QR codes. So the school children can immediately, all of them are carrying mobile phones, and they can scan it and listen to his voice.
So these are the QR codes you can scan and then listen on your own mobile.
Or listen on your own mobile, his own voice. So this will regenerate the Gandhian way of life. And I think one simple point about Gandhian philosophy, less is more, has to be emphasized in today's society, and the young children have to learn that. Less is more.
What prompted you to bring this out?
Actually, it's a long story. What happened was, when I assumed charge as the Secretary, Department of Health Research and Director General of Indian Council of Medical Research, I was approached by the Secretary Culture at that time to make a PowerPoint presentation on Gandhi and how we can have digital Gandhi, and we made that PowerPoint presentation and gave it, which was ultimately sent to the PMO as well. And then the secretary moved, and he said, many of your ideas have been approved, including the museums and all those, etc. But we then decided that we'll do a special supplement volume on health. And that prompted us to work on this. And we found three excellent people, Dr. Annamalai, who is the director of the National Gandhi Museum, Dr. Abhay Bang, who is running the Gadchiroli ashram, and Dr. Rajnikant from the Indian Council of Medical Research. And the three of them worked tirelessly to get this volume out. We had excellent contributions from some of our directors of our different institutes. And more importantly, if you look at the back cover, we have a special painting that one of the most famous contemporary modern art painters, Miss Aparna Kaur, painted it only for this volume. And she presented me with the original, and the original is reproduced on this book. And
Fantastic, which is his ECG and his famous walk.
exactly, his ECG and his famous walk.
Have you been influenced personally by Gandhi's way of thinking? Did you ever meet him?
Definitely not meet him, because I was born much after his death, but I have been influenced by his philosophies of life. In fact, I had started an innovation program with Stanford University and IIT Delhi in 2007, and at that point in time, the Stanford thinking was talking of very high-end devices for artificial intelligence and robotics, and I realized that that is not relevant for our India. We need to get down to the ground level and do something which is relevant for India, and it has to be low cost. And that is why I coined the word frugal innovation at that point in time. And we were able to develop a lot of these frugal medical devices which are now in the Indian market, and one of them has also been approved in the United States of America, frugal medical devices. And here I want to emphasize one little point. See, in today's time, innovation is driven by the reward that you're going to get. So I firmly believe that Gandhian innovation and Edisonian innovation. Edisonian is the American way of thinking, and he was the gentleman who patented the light bulb, and then he had more than a few hundred patents, and he said that anything that won't sell, I don't want to invent. Whilst Gandhi, on the other hand, said that there is a very thin line between need and greed. So in today's time, I think we have to, all youngsters and young innovators have to move on the delicate line between Gandhian and Edisonian innovation and keep a balance.
So, you met the Dalai Lama. What was his message, and does he think Gandhi is relevant today and his health practices?
Absolutely. I mean, the idea of requesting the Dalai Lama to release this book was because if you look at after Gandhi, there was Martin Luther King, there was Nelson Mandela, Bishop Desmond Tutu. I think they were Gandhians in the real sense. And the only living Gandhi that we have is His Holiness the Dalai Lama. And therefore we felt that it may be most appropriate that he releases this book. And his thinking is absolutely influenced by Gandhian thoughts. Do for others, give others. And he emphasized on one word today which really rings in our ears, and that is Karuna, Karuna, Karuna. And that is our culture. And he says, your country has in these thousands of years demonstrated to the world how harmoniously you have live and how you give. That should be reincarnated. And I hope this book can spread a drop in that ocean of creating that sense of being able to give to others.
So, the ICMR, which is one of the most respected Indian institutions, respecting and giving love to Gandhi?
Absolutely. Respecting and giving love to Gandhi and dedicating this volume to his Gandhi, who is going to live for eternity.
So, that was Dr. Balaram Bhargav. If you noticed, he didn't say he practices Gandhian philosophy, but he said the innovations he did as part of the biodesign team were all which would help the last person, the common person. So, ICMR reaching out and taking Gandhi into the future, into times which are most relevant, where Gandhi's philosophy needs to be brought to the people. This volume will touch many lives. And this interview is being done right in the temple where Dalai Lama practices and teaches in Dharamshala, Pallav Bagla.